So pterygopalatine ganglion, it is one of the four ganglion of parasympathetic system in the head neck region. So it is also called as ganglion of hay fever. The pterygopalatine ganglion is the largest of the peripheral parasympathetic ganglia. It is placed deeply in the pterygopalatine fossa near the sphenopalatine foramen and anterior to the pterygoid canal and foramen rotundum. It is flattened reddish gray in color and lies just below the maxillary nerve as it crosses the pterygopalatine fossa. So if you see the parasympathetic route, the preganglionic parasympathetic fibers destined for the pterygopalatine ganglion run initially from the lacrimated nucleus of lower pons, nervus intermedius, then the trunk of the facial nerve, and the geniculate ganglion of the facial nerve, and greater petrosal branch of the facial nerve, and then in the nerve of the pterygoid canal, which is the median nerve. So this median nerve is formed by joining of the greater petrosal nerve and the deep petrosal nerve. Deep petrosal nerve is derived from the internal carotid plexus. The nerve of the pterygoid canal enters the ganglion posteriorly. The postganglionic parasympathetic fibers leave the ganglion and join the maxillary nerve via a ganglionic branch, then travel via the zygomatic and zygomaticotemporal branches of the maxillary nerve to the lacrimal gland. The preganglionic sensory-motor fibers of uncertain origin also travel in the nerve of pterygoid canal. The synapse in the pterygopalatine ganglion and postganglion fibers are distributed to palatine, pharyngeal, and nasal mucous glands via palatine and nasal branches of the maxillary nerve. Postganglionic sympathetic fibers pass through the ganglion without synapsing and supply blood vessels and orbitalis muscle. They arise in the superior cervical ganglion of the sympathetic chain and travel via the internal carotid plexus and deep petrosal nerve to enter the pterygopalatine ganglion within the nerve of the pterygoid canal. Then the general sensory fibers destined for distribution via orbital, nasopalatine, superior alveolar, palatine, and pharyngeal branches of the maxillary division of the trigeminal nerve run through the ganglion without synapsing. So sympathetic fibers and sensory fibers, they are not relaying in the pterygopalatine ganglion, whereas parasympathetic fibers are relaying in the pterygopalatine ganglion. So branches, the orbital branches which supply the periosteum of orbit, orbitalis muscle, sphenoidal and posterior ethmoidal sinuses. The palatine branches, the greater palatine nerve supplies the hard palate and adjoining gum and also gives posterior inferior nasal nerves. And lesser palatine nerve supplies the soft palate and palatine tonsil. The nasal branches are divided into posterior superior lateral nasal branches which are around 6 in number for lateral wall of nose and posterior superior medial nasal branches for nasal septum. So one of these posterior superior medial nasal branch is long and is called as nasopalatine or sphenopalatine nerve. Then pharyngeal branch supplies the nasopharynx. You can see here. So this is the maxillary nerve passing through the foramen rotundum, and here you can see the pterygopalatine ganglion connected to the maxillary nerve located in the pterygopalatine fossa. Thank you.